Welcome to AFMC TV. I'm Robin Linder.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults who were very creative.
Down on the floor and play with their kids.
AFMC TV, thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have Rachel Bunch with me. She's the Executive Director of the Arkansas Healthcare Association. Rachel, thanks for being here.
Thank you for having me.
So we're talking about some exciting nursing programs here in the state, and this is the first program of its kind in the country.
That's correct.
So tell us why it is important for Arkansas to lead the way in this initiative.
Sure. So everyone, you hear about workforce crisis and healthcare workers really at all different levels. And it's something that's been a priority for us for many years. But this was really an opportunity that we saw and kind of worked to put the pieces together and thought we would try something new and different that hadn't been done before. So it's the first nursing program of its kind owned and operated by a long-term care healthcare association. It's also the first MAC or medication assistant to LPN bridge program that we've heard of. There are a lot of 0 to LPN programs. There are LPN to RN programs, but we think this new bridge that we've developed with different steps along the way will be practical and also a way for working adults to achieve a nursing certificate or license as they work in healthcare.
It's so interesting. What are the challenges in healthcare staffing does this program directly address, especially in our state's nursing facilities?
We have a major shortage of nurses to work at the bedside. So LPN and RN, I think that we have a lot of nurses that in many cases work lots and lots of overtime and lots of extra hours to help meet the needs of the patients. And I think we burn workers out sometimes. I think we have a lot of workers that could be working at the height of their license, and this gives a different opportunity for that to happen. But we don't have enough licensed personnel in the state. One thing that we found in researching to get ready to start this program, in the state of Arkansas, the number of licensed LPNs coming out of existing programs or colleges has declined for LPNs by 40% over the last 10 years. So over the last 10 years, number of LPNs has declined 40% in Arkansas. The number of RNs produced by the traditional programs has increased ever so slightly, still not enough to meet demand. But when we saw that statistic on LPNs and that drop, while demand has gone up significantly for both LPNs and RNs, it seemed like LPN was the first step for us to try to make a difference.
And walk us through how the pathway works from CNA to MAC to LPN. What makes this ladder of advancement so valuable for healthcare workers?
Sure. So jumping from all the way from CNA to LPN represents on average a 70% pay increase for that employee. And you think about what 70% of an income means to someone and their family in rural Arkansas. We have a lot of single moms. We have a lot of families and people that work in our facilities. And this is a great way to give them an opportunity to make a career out of this and not just a job. So we started with existing CNAs. You hear a lot about high school programs, bringing in new workers, outside workers, but we felt that the best place to start was to look at our existing workers who are right in our facilities in rural Arkansas, urban, rural, everywhere in Arkansas, looking at those workers and helping them to advance. Most of these people, when we polled them, most of them have never been to college, never been to nursing school, but have always wanted to. They are dedicated staff. They show up. They have been there year after year, many of them through the pandemic, and have stayed with the facilities and stayed in healthcare, but have never had the opportunities. When we surveyed them about those opportunities, it was usually due to a lack of childcare. It didn't work with their schedule. They didn't have the money to go to school. They couldn't go to a traditional program and still work at the same time. So we started out with the MAC program first. So we took existing CNAs and we developed a program that is mobile, goes around the state. We have over 20 sites in the state. And when we have enough CNAs in a region, we send a team, we send staff members and equipment, supplies, and we go and we do a class locally for them. It's a little over 3 weeks, and they do that class every day. We got a grant to cover the tuition. The facilities pay their regular wages while they are with us in the class. They finish their certification. They go back to their facility and do clinicals in their home facility. And then after that, they sit for the state license exam, and then they get to go back to work passing meds. Now, these are the same CNAs who know the patients, care about the patients, have been there and invested in them. It allows them to work at the height of their new scope, but also allows those nurses on the floor who have been passing meds to work at the height of their scope. So it really takes burden off of the nurses on the floor, allows them to do more higher level patient care, and allows the MAC to start passing meds and other CNAs to kind of backfill in the pipeline. So we take existing CNAs, and for them to become MACs, it's really been a game changer in our facilities. And then after that, we started the LPN program, and the LPN program, we've got 3 locations: Little Rock, Rogers, and Jonesboro. We're already looking to expand, but we are not quite halfway into our first cohort. They'll graduate in April. They are in class with us Tuesdays, Wednesdays, and Thursdays, and then they work as a MAC in their facilities Monday, Friday, and Saturday. And so it's a 10-month program, and the tuition is waived. They have no tuition, no cost to attend the program. They will have no student debt. The facilities will pay their testing fees when they're finished with the program, and they are guaranteed a spot to work as an LPN in that same facility. And one of my favorite statistics about the program is that of our current LPN cohort, of the 70 students that we have, the MACs that are in the LPN program, on average, they have been CNAs for about 10 years in our nursing homes. And so these are people who are truly dedicated and truly deserving, and I think they will make exceptional nurses.
It sounds amazing. And you mentioned this a few times, that it is free. So there is a grant involved that helps pay and cover tuition for anyone that's admitted into the program?
Anyone and everyone. And so it's a combination grant money from the state of Arkansas, from the Office of Skills Development, and funding from the Arkansas Healthcare Association. And then our facilities are helping as well. So it's a group effort, but it is at no cost for those employees.
Wow. So how does the partnership, is it Ozarka College, fit into this program? And what role does that play in preparing students?
Yeah. So Ozarka College is a college in North Central Arkansas. They have 3 different locations. They do a really, really great job with non-traditional students, and they have a great LPN and LPN to RN program up there. And so we started working with them. All of our students take an online prerequisite class. You know, when you sign up to go to a traditional nursing school, oftentimes you have prereq classes. We identified one prereq class that we wanted all of our students to take, and they do that online through Ozarka. It's body structure and function. It's kind of like anatomy and physiology. They take that online in one semester, and they're able to use state grant resources that are based on income eligibility levels to cover the cost of that class. So they do that online, and that's the prereq class. And then once they finish that class, they're eligible to begin our program.
And you touched on this a little bit as well, about how these are lots of CNAs that are invested and have careers in these facilities. How will this program change opportunities for frontline caregivers, especially those who may not have thought becoming an LPN that's now within reach?
Absolutely. So I think it's an excellent way for us to give back to those workers and to invest in them. Many of them are CNAs, and their mom was a CNA, their sister's a CNA. They knew someone, a friend, someone at church, someone who was a CNA. And many of them have done that for a long time. And I don't know that the traditional train of thought is that if you become a CNA, you can automatically bridge that to other areas of healthcare. Sometimes you see CNAs that jump around. That might be a patient care tech at a hospital or a medical assistant. Different. This is, to me, this is a way to break through those barriers and allow someone who is interested in healthcare, dedicated to healthcare, they know they want to work in healthcare, allow them a way up the career ladder without the burden of, time and the classes and the funding.
And from a community perspective, what does filling these LPN positions mean for patient care and quality in nursing facilities?
I think it will absolutely translate to an improvement. I think that we know that we need to continue to grow our staff. People talk about the numbers and the baby boomers, and that's absolutely real. And we also have a number of nurses that are retiring, and a lot of the statistics show about nurses leaving the workforce. And we want to do 70 feels small, even when you think about the numbers that are needed here. And I think about the growth and the opportunity. But I know that these people will make a difference.
And do you see this as a model that other states could adopt? And what would it mean for, say, the national nursing shortage if they did?
I think absolutely. And this is, to me, an example of the power of an association, of our members coming together. One facility doing this alone doesn't really make sense. But facilities coming together like this and able to share resources through our association has been really helpful here and has made this come to life. And so we're now working with our members in different parts of the state. We just got approval 2 weeks ago to add a program site in 2026 in Fort Smith. So we'll be adding there. And then we're constantly polling and evaluating our members to see where else do they have gaps. And that's where we can come in and share and bring resources to them.
And finally, what message do you want to share with current CNAs or MACs who might be considering this path?
You can do it. Go for it. Absolutely. You have it in you. Just because you haven't been to college or haven't been to nursing school, today is the day to start. There is no one holding you back but yourself. Our facilities are so proud of these frontline workers and what they have done and what they continue to do to take care of our patients. And we want this program to fit them. And we have excellent faculty and staff. We want them to go for it. And we have a lot of our facilities are rooting them on. And we want to see long-term care workers and people who care about long-term care grow and advance and get that license behind their name and stick with us and to keep working in healthcare.
Well, Rachel, thank you so much for being here today and sharing this important information. And thank you for all that you're doing for the future of nursing in our state.
Thank you. Thank you so much.
And that's it for this episode of AFMC TV. Thanks for watching and have a great day.